So if you've had problems with your shoulders and you don't know why, I got to go over these two questions that I was asked this week by patients that may help you understand why you keep having that problem. So I'm Dr. Gregg with Align Wellness Center, and I help people to remove the blockages from their life to get back to living amazing, fantastic lives. So the first one actually was from a patient of ours who's a medical doctor, and she was asking if she needed to go to see someone who strictly focuses in her shoulder to get some help. On this visit, it was one of the first ones she shared with me that she had shoulder difficulty. And I said, let's look in, figure out what's going on. We went through and we did our adjustment and our care for her and several of the tests. And before she left, the pain was gone. Now, she really didn't understand quite why, so I went through and explained it, and that's what I'm gonna do for you. So for her, her posture and position of her body has changed so that her shoulders are a little bit rotated forward on her rib cage. Now that winds up putting the entire shoulder girdle, the shoulder bones and muscles, in a risky place where they can't use the mechanical advantage that they were designed to have. You see, the shoulder is a very unique joint in that it just rests on your scapula, and then all of this motion is controlled by muscles. The stabilization is also primarily controlled by muscles as well. So when your posture changes and your position of your scapula on your rib cage changes, so does the way your shoulder muscles work. Now, the small muscles that stabilize your shoulder are really only designed to work in the position that they were originally planned on, right on the outsides of your shoulders. So when it moves forward, it becomes weakened and has difficulty lifting the shoulder up, particularly getting above your head. And these are the reasons why people continue to have regular reoccurring shoulder issues. Not because there's inflammation or anything like that, but because the mechanics of your shoulders. The key to figuring out this problem is that we've got to understand why the shoulder has moved forward on the rib cage to begin to change the postures and position. The person who's well equipped to do this winds up being a corrective chiropractor. If you like videos like this, feel free to give it a thumbs up. If you're looking for someone to help you with it, go ahead and write down below. The other question that I got asked this week about shoulders is, should I wear one of those harnesses or one of those vibrators that goes in the middle of your back to let you know when you've got poor posture? The answer is that those are really temporary fixes. And actually the harnesses that hold you back, they're actually really bad for your posture. What the problem is with these is that the muscles through the upper back are not working properly. And the challenge with it in most cases is that the cervical spine is disconnected from them. So we can work on making those muscles strong and bringing your shoulders back. However, if the connections aren't good, all the strength in the world is not going to hold the shoulder in the right position. So you got to make sure the connections going from your brain through your cervical spine out to those muscles know what to do. When you wear those straps that hold your shoulders back, you're turning those muscles off and not letting them work any longer, so it's ultra bad. If you've got more questions about shoulder and how it works, how to stabilize it, and anything else, feel free to write them down below. I do my best to wind up replying to these and responding to these to get you the information you need. Once again, my name is Dr. Gregg, and I want to thank you for letting me be a part of your health.